Hi everyone, Katie Ottleman, Director of Content and Communications with the Rochester Downtown Alliance here. And if you're anything like me and working remotely, you're probably realizing that an improperly set up workspace is causing you some aches and pains. And that's why I'm on with Ray Lunason, a physical therapist. Dr. Ray, I'll let you kind of introduce yourself and explain about your professional background.
Awesome. Thanks, Katie. Hi, everybody. So my name is Ray, as Katie had mentioned. I am a physical therapist and I practice with the Mayo Clinic Health System, actually in Austin, Minnesota. But I am actually originally from the Philadelphia area. I've been practicing as a physical therapist for over 5 years now. And I actually moved out from the Philadelphia area back in 2012, where I attended physical therapy school at the Mayo Clinic. One of the things that I typically do what they call manual therapy, so a lot of hands-on techniques, but then also there are a few additional credentials that I have. I am an orthopedic clinical specialist. I am fellowship trained in orthopedic manual therapy, and I'm also a certified strength and conditioning specialist. So my wife says that I have a bunch of letters behind my name, and it's just like I'm trying to pursue the whole alphabet, and she's not wrong.
Alphabet soup behind your name, isn't it?
Yeah, for sure.
All right. Well, it sounds like you cover a wide range of things related to the body, and that probably helps a lot of us that are working remotely in response to COVID-19 and may not have a properly set up workspace arrangement. So what things should people consider when they're setting up an ergonomic at-home office?
I think that's such a great question, especially with the epidemic that's going on and how everyone is kind of hunkered down in their house. One of the things for starters is that if there's anyone working from home who's trying to set up a comfortable workstation, the thing that you have to consider simply are just the home environment and then trying to choose the ideal location of that workstation. Because the thing is like with wherever you're going to set it up, you have to keep in mind like the lighting of a room. If it's not bright enough, that can affect your eyes, that can affect how comfortable the area is. Other things to consider, the furniture that you're going to be using. So if you have an adjustable chair, one that's, as I say, pneumatic, where you can actually go up or down, the better adjusted. The type of chair itself, if it actually has a backrest. If you're just going to use a good old wooden kitchen chair, it might not be the most comfortable. Other things too is table height and foot support, or even the hardness of the surface. Also, the things to consider with that are simply the computer that you're using. Most people, if they are working from home and they typically are working in the office, they don't have the luxury of sometimes having a desktop. They have to just take their laptop and work from that for a very long time, and that could be problematic as well. Sometimes that actually ends up having more what they call musculoskeletal disorders. And being at a computer and a lot of computer work, you can end up having spine pain that can involve the neck, the back, or the low back, shoulder pain, wrist pain, elbow pain, even leg pain. So I would say it's almost an investment into yourself if you were willing to cough up the extra bucks and whatever else to try to get these items, but just for your own benefit in the long run.
Absolutely. But I mean, even if it's, if your computer is sitting lower, you could almost put a book under your computer to raise it up and not getting a, $50, something else. Are there any other helpful tips that you could maybe utilize around the house that would help with some of the things you're talking about, Ray?
Yeah, there definitely are some simple like tips and tricks. One of the things that I usually tell my patients to try to think about or use if they don't have like a lumbar support or some lumbar pillow, you can be pretty savvy and just use a bath towel like this. And all you need to do, you can roll it up if you want to, and just put it behind you. And that should be enough to give you enough back support, just to kind of demonstrate it. It's kind of just here, and now instead of sitting like this, I'm able to kind of be more upright. Other things you can kind of consider for a footrest, because sometimes some of the chairs that you may have can be kind of too tall for you if the table's there. You can be creative and use the trash can and just put it on its side, and that can be used as a makeshift footstool. And then
Nice.
there you can actually have a good posture to make sure that it's more comfortable for you.
Nice. Yeah, I like all those options, and it's something that you probably have something similar around the house that you can utilize. So that's really great tips. Yeah, and this is going off topic, so putting you on the spot here. If you had to prioritize kind of one key thing that would probably help alleviate the most, what would you recommend?
I would say if you are a laptop user, which a lot of people are, I would say using like probably spending $20 and buying yourself a wired keyboard and mouse. Just that's just square one. Because then instead of trying to hunch over like this, when you're trying to just type on a laptop and looking down, you can be away from that laptop and then even put it up on some books like you mentioned, so that it's now elevated, and then you have the proper positioning of your body to make it more comfortable for you. $20 isn't so bad.
No, no, in the long run, like you said, it's an investment in yourself. And if it's just 20 bucks, that's the start.
Yeah, for sure.
What tips do you have for, if while you're in front of a screen, if it's, getting up every once in a while, what kind of advice would you give?
I would say that we should take breaks. There's been research to support that frequent short breaks, either being about 5 minutes at a time, every 20 minutes or so, just to look away from your screen to rest your eyes, or even just getting up to get a drink, take a little lap around your house to go back into the office. That would all work, because the thing is that the reason people end up having pain or discomfort or any difficulty with sitting for a really long time is because you're putting a lot of demand on our body to stay stationary, and our bodies were designed to move. So the biggest thing with ergonomics, the research does support that, with poor posture and a poor ergonomic setup, that can really lead to a lot of the issues that people experience with neck pain or shoulder pain and back pain. A lot of studies talk about even just the simple education of ergonomics can really change someone's know-how or knowing how to manage their symptoms. Because most people are like, I had no idea that having my elbows up this high, or the fact that I would look down like this, is really going to impact me in the long run. So now when you're equipped with that knowledge, then my job is done, because then if I have empowered you, I have educated you so that you honestly could take care of yourself, because our bodies are amazing and they can do that. And all I want to do is just make sure that I can provide that information to whoever out there.
All right. Well, I definitely have things to work on, and I hope our listeners have learned a little bit as well. So, Dr. Ray, thank you very much for your time. Definitely appreciate all the helpful information.
Yeah, you're very welcome. It was a pleasure to do this.